Hello and welcome to North Country Matters. My name is Donna Seymour. I'm a member of the St. Lawrence County League of Women Voters, one of the civic partners for our show. My guest today is Julia Solow, the lead organizer for Hand in Hand, the Domestic Employers Network and the Caring Majority Rising. She is a colleague of both Alana Berger and Bobby Sackman, who have always also been guests on the show before to talk about home care issues. Julia, welcome to North Country Matters. I'm so glad you can be with us today to talk about the Consumer Directed Personal Assistance Program, which is a mouthful, otherwise known as the CDPAP program for home care, its importance in our state, and where things stand right now. So, would you take a minute, Julia, to tell us about yourself and how you got into this kind of advocacy work, please?
Sure. Thank you so much for having me on. I'd say, how did I get into advocacy work? Starts from my childhood and my grandparents, particularly my grandma on my dad's side, was a lifelong organizer and really instilled sort of social justice values in me from an early age. And then on a personal level, also as a child, I dealt with some mental health struggles that I think also really inform why I do the work that I do. At 9 years old, I developed anorexia, and I struggled with that for 11 years. Um, and I think that even from a really young age, I kind of recognized that part of why I was dealing with this is because we live in such a toxic culture that impacts us to the core, and that there are people who actually benefit when people hate themselves. And so I see these social justice fights, whatever they are. I know I've been involved in immigrant rights movement and tenant rights and now healthcare justice work. I see all of these fights as really people really claiming their worth and their inherent dignity, and that we deserve more. And so there's something very liberatory about organizing work in that way. It was being involved in organizing work that like pushed me to come out as a queer person, right? Seeing people coming out, and really being proud of their identities, is part of organizing. And I think so that's been very powerful for me. I'll stop there.
No, that's good. And I think your story is a lot of people's story in that you have a family history of organizing and that you took your own struggles and turned that into action. And that is exactly what many, many people do with not only their own personal history, but their family history. So that's very empowering, as you say. So, Julia, what is the CDPAP program? Who does it serve? And how important is it to the overall home care networks of services here in New York State?
So the consumer directed program is a very popular home care program that's in New York State. It's also in other states, that allows people to hire someone of their choosing, be it a relative, a neighbor, somebody who they find, who they trust, to provide their home care. And so this is the one home care program that was fought for and won by people with disabilities, who wanted to have a say over who comes into their home and does, intimate personal care. Um, and so right now there's 250,000 New Yorkers who receive home care through this program. It operates through Medicaid, which is really one of the number one ways that people access home care without paying out of pocket. Um, and yeah, it is a very crucial program. In many parts of the states, it's the only kind of home care you can get. I know that's something that's probably really relevant for the North Country and more rural areas, is that sometimes the traditional home care agency, like, literally doesn't have the workforce to serve your area. So you're on your own and you need to find somebody. And so this is a particularly important program in some of these more far-flung areas where that's the only kind of home care people can get. Yeah.
Now, you make a very good point about rural areas and how difficult it is to find help, home care agency or even private, for people to do that. And of course, we know that for people who do home care often are underpaid. They're low-wage workers. And so this program helps to put some money in their pocket and allow them to do the kind of work that these folks need. And your point about someone that you can trust is very important because, as you say, this is very personal care, and you don't want to be just any old person walking through your front door. So I think you make a good point there too. So your organization did a lot to educate not only the public, but legislators about the CDPAP program during the budget process earlier this year. And the governor's budget proposal, which would have hurt the program, yet, despite all that work this spring, the governor still wants to award $9 billion. That is $9 billion with a B dollars to a corporation, a corporate entity to run the CDPAP program. This would effectively be a huge transfer of public dollars to private corporation with little or no state oversight, and we have no idea how the money is being spent or if it's actually helping the people this program is designed to help. So what would be the consequences of that kind of a transfer of wealth?
Yeah. There's tremendous consequence. And there's just the process of getting 250,000 people, from transferring them from and their home care workers from the 600 providers that currently operate the program to one, would probably, like, that transition would probably result in people going people's aides going without pay, potentially for months. This is something that's happened in other states that have had this transition, where, during the transition, home care workers, like, weren't paid. There, and, if you're not getting paid, you're gonna leave your job, right? You have to survive and feed your own family. And so there's a huge risk of people losing their home care, and potentially being, home without care, which can be extremely dangerous, or being forced into a nursing home, which also can be extremely dangerous. And so there's a risk of people losing their aides. There's a risk of the sort of this monopoly entity paying people the bare minimum. Right now there are providers in New York State that do whatever they can to increase pay. If they can pay an aide who's worked a long time, like $19 or $20 an hour, they'll figure out a way to do that. That same consideration might not be the case under this monopoly. And so some workers might see a pay cut, which again could result in workers leaving the field, and leaving that would leave the consumers in, like, a really impossible situation when it comes to care. Yeah.
So you make a really good point too about people being forced into nursing homes because that is absolutely the most expensive care out there. In fact, the average nursing home cost is $140,000 per patient per year. And if we think that paying home care workers $15 or $20 an hour is expensive, think about what that drain would be on the public dollars. Your point about a corporate entity also, we've seen in healthcare private equity firms come in over and over again, and they strip mine as much value as they can out of it and treat workers very, very poorly. And with as difficult as it is to find home care workers in the first place, driving more of them out is only going to make a bad situation much worse, isn't it?
Absolutely, absolutely. Yeah, it's a very short-sighted move. It will end up costing the state more in the long run. Um, and uh, yeah, one of the proposals we put forward earlier this year would address some of the corporate profiteering in our home care system. And that still needs more advocacy. But there are, private insurance companies have gotten their hands into our Medicaid system since 2011. And um, there is a lot of profiteering that happens with the insurance companies actually keeping, billions in state dollars that are meant for home care. And so instead of instead of addressing the waste that's happening on um, that end of things, the governor instead is has hastily moving forward with a proposal that would end up um, really punishing people with disabilities and their caregivers. And so we need to stop this proposal in its tracks and stop it from moving forward. Yeah.
I know that some legislators have actually begun to question this process, and that's a good thing. I wish they had done that during the budget process, but as we know, in New York State, the budget process is I think we can say screwed up at the least amount of what we can say about it. So right now, where do things stand? This proposal it's still on the table, but is anything happening with it?
Yeah, and I shouldn't call it a proposal because it is actually policy. Like this is actually what is moving forward right now.
Okay.
Um, but it hasn't been implemented yet, right? It's like there's gears are moving to block it with legal action. There's Senator Rivera, the chair of the Health Committee, has is working on legislation that would repeal this. Senator Mannion led a group of legislators who sent a letter to the federal government to investigate whether or not this is even feasible and whether like just to review the decision. um and so there are definitely gears in motion to stop this from moving forward. The contract like between the single monopoly fiscal intermediary and the state is supposed to be signed on October 1st. Um, and the transition is supposed to happen by April 1st of next year. Um, so this is a very quick timeline and very unrealistic timeline when you consider that other states that have done this transition have had far fewer people to transition and have had a longer stretch of time to make that transition. Um, and so, uh, I mean, the other way that we are putting pressure, our partners at CDPANIs, which is the Consumer Directed Personal Assistance Association of New York State. They have an ad campaign right now, to generate some public pressure. We are showing up at the governor's different events to try to talk to her about this issue. So on many levels, there's a pressure campaign that's building in the state to stop this from moving forward and kind of go the way of congestion pricing if we can. We have seen this governor backtrack on things before. And so we are hoping that we can make that happen with this.
Well, that sounds good. So, from the point of view of your organization, this is what needs to happen now is to get things to slow down. How can citizens help? What can the average person do to help get the message across to the governor?
Definitely. So, I mean, I think the traditional like phone calls and letter writing is powerful. Like if you have a personal story, if you use the consumer directed program, or you're a PA, a personal assistant through this program, writing a letter to the editor in your local paper is a really powerful way to get your story out there, and get public attention on the issue. We have a letter writing campaign right now, where we're collecting thousands of letters to the governor, and to the leadership of the legislature, that we're planning to deliver in person on October 1st to the various offices of these targets. So I'm happy to share the link to send a letter and be part of that letter delivery. There's amplifying our message on social media. If you are on Twitter or Instagram, Facebook, there's a campaign called Protect Home Care. It's protecthomecare.org. This is the coalition that has been running ads. And so they have been posting on social media, and have a website that I can also share. So these are some ways that you can take action. Just even calling up your personal like state senator and state assembly member and asking them to be vocal. We need an outcry, not just from the public, but from our representatives. So even something as simple as your senator posting something publicly on social media, about why this would be a disastrous move and that this is not tenable, and we need to be investing in home care, not destroying it. That goes a long way, right? I think all of our actions have a cumulative effect.
You make a good point. And also, of course, for those, this is an election year for both the Senate and the Assembly. So if you are in a position to have a conversation, maybe at a campaign event or a debate or something like that, this would be a great question to raise up to the candidates, wouldn't it? Bring some visibility to it and indicate that it's an issue that voters care about.
Absolutely. Mm-hmm.
So
That's a
if
great idea.
Yeah, well, if we are successful in getting the campaign to at least put more time in it so that the contract is not signed by October 1st, this then again, of course, spills over probably into the next year's budget cycle, doesn't it? So is that another opportunity for advocacy?
Absolutely, yes. Especially once we have this repeal legislation, there will be an opportunity to, drum up support, get sign-ons, co-sponsors. The the name of the game right now is to delay, 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 and then like try to, get rid of this thing during the budget season.
Okay, that sounds good. So, Julia, as you know, voters in New York State will have an opportunity to vote on ballot proposal 1 this fall. It's the so-called Equal Rights Amendment, and it will add important protections to our state constitution, which are not currently included. And two important protections would be for age discrimination and disability discrimination, which in many cases covers both of the conditions of the people who the CDPAP program is helping, because many of them are elderly and many of them are disabled. So our state population of adults 60 and over is projected to grow by another 5.3 by the end of this decade, 5.3 million, excuse me, by the end of the decade. And those over 80 are expected to exceed 1.2 million. And many of them want to stay at home. They do not want to be put into an institution. They want to be able to stay at home where their family and their social network can support them. So nationally, 1 in 4 Americans has some form of disability. So for many people, this is a double whammy, isn't it? You're getting older and you've got a disability, and now the care that you want to have happen in your home is not available to you. Julia, what would a yes vote on Proposition 1 do for New Yorkers who fall into these categories? And let's face it, if we live long enough, we're all going to be elderly, and many of us are going to have a disability. So it's something that we should be thinking about now, how to protect ourselves and our families, isn't it?
Absolutely, absolutely. Yeah, so the Equal Rights Amendment would sort of enshrine certain protections in the New York State Constitution. Um, I think that this is incredibly important, is in particular for the reproductive health care, because of the threats to reproductive justice nationally. It just I mean, I would say that there are already some protections that we have under Olmstead as well, that protect your right to live in the most integrated community setting. And so I would need to get back to you on the how it specifically could add like an additional layer of protection for older and disabled folks to live in the community, what it would do beyond what our current protections provide. But I think this is, any amount of enshrining our rights in the Constitution will help our argument, when it comes to these different forms of discrimination.
Well, Julia, thank you so much for your thoughts on that and for coming in today to talk about where we are at with this particular proposal. Clearly, right now is the time for people to act and to get a hold of their legislators and to get a hold of the governor and get a hold of the leaders in our state, because with an October 1st deadline coming up, and sign a contract that there is no way they're prepared to actually provide a continuity of service. That seems very clear, isn't it? So that's very important. So thank you for coming in. Thank you for the work that you and your colleagues are doing. I will be sure to put the links that you mentioned in our show notes so that when people watch this, they'll have the information. And this is such an important conversation, and I really appreciate you taking the time to come in and have it with us.
Thank you so much for the opportunity.
Well, you're more than welcome. So these conversations are a production of North Country Matters. This show is a civic collaboration between the St. Lawrence County League of Women Voters and the Potsdam Public Library. I want to remind all of you that Election Day is November 5th, which is preceded by 9 days of early voting here in New York State from October 25th to November 3rd. You can request an absentee ballot or a ballot by mail if you're unable to get to the polls. Be sure to flip your ballot so that you have an opportunity to vote on the New York State Proposition 1. Propositions are always on the back of the ballot. So the people you vote for are on the front, but in order to vote for the ballot, on the proposition, you have to flip it to protect yourself and your family from discrimination. Please remember that our North Country matters.